Good morning, everyone.
Good morning.
We can do better than that. We're in Aspen, the sun is shining. Good morning, everyone.
Good morning.
Excellent. I am so pleased to welcome you to today's event entitled Navigating the Health Information Maze. It is such a pleasure to see you all here. I'm Dr. Charlotte Owens. I've been an obstetrician gynecologist for more than 20 years, half of that time on faculty at the Morehouse School of Medicine. But I'm currently the head of the Center for Health Equity and Patient Affairs at Takeda Pharmaceuticals, and I'm so pleased that you're here. You know, this session is really important, and the reason why it's so important is because I believe that everyone has the right to obtain their highest level of health, regardless of where they live, where they're born, where they laugh, where they play, and where they work. And part of that ability to obtain your highest level of health is having access to reliable health information. This is essential to healthier people and healthier communities. It's amazing to be at Aspen and to have access to all of the new technologies, programs, and platforms here today. But we cannot forget the fact that despite all of the tech benefits, we can't ignore the potential for advanced technology to leave people behind if we're not careful. Tech is limited to those who have access to it. Today, in the US and abroad, there are many, many people with limited or no access to internet, no smartphone, limited data packages. And because of that, they're left behind. There are also people who have a problem maybe with understanding information, or even worse, misunderstanding information because of the way that it is presented. I am sure that you're going to find today's session very productive, and you're going to leave from here inspired and more informed on how you can use technology to create a healthier world. With all of that said, I'd like to introduce your amazing moderator, Dr. Celine Gounder. She's a medical contributor at CBS News. We've all seen her a lot. She's also a senior fellow at the Kaiser Family Foundation and editor-at-large for public health at the Kaiser Family Foundation Health News. Celine?
Thank you so much, and welcome to Aspen Ideas Health. We have two panelists here today, Neera Gorin, who is the head of health information quality at Google Health and YouTube Health. Her team tackles health misinformation and ensures the quality of health information across the platforms. She's also a pediatrician. And Megan Rainey, who is an emergency physician and the incoming dean of the Yale School of Public Health. Her research focuses on developing, testing, and disseminating digital health interventions to prevent violence and related behavioral health problems, as well as on COVID-related risk reduction. She's also a senior strategic advisor to a firm here at the Aspen Institute, which is focused on ending gun violence through a nonpartisan public health approach. She is a fellow of the Aspen Institute's Health Innovators Fellowship and a member of the Aspen Global Leadership Network. So in March of 2021, the National Academy of Medicine launched a project to provide guidance on how to identify credible sources of health information in social media. The project was sponsored by a group at YouTube and was advised by an independent expert group composed of various experts in information governance, health information development, public health and health equity, social media and misinformation, and science communication. So Megan, you were part of this independent expert group, and Neera, some of your colleagues were involved in this as well, having commissioned this project. I'd like to start with you, Megan. How can consumers differentiate between what is credible and non-credible as a source of information?
So I think this gets at the big challenge in front of us right now as we think about health information and technology. When you open TikTok or Twitter or YouTube, and I'll talk a little about YouTube and I'll let you do so as well, traditionally it's been very difficult to know when you look at an article, when you look at an image, is this real or not real? Many of us, many of our parents and friends have probably been taken in by some misinformation, which is things that aren't quite right, or frank disinformation, which are lies that are being spread purposefully to change our knowledge and behaviors around health. Traditionally, there's been no marker of what's good or not. I'll tell people if I go back 3 or 4 years, I would say, well, look for things from trusted sources like WebMD or Medscape or KFF or the New England Journal of Medicine. But as we got into COVID, we couldn't necessarily depend on those trusted sources because the pace of change of knowledge was quicker than the pace of production of peer-reviewed literature. So this problem became much more acute. That's what led us to take on this project around credible messengers, was the question of how do we identify for the public who you can trust? And how do we decide what trustworthiness looks like for the average person who may not have any background in medicine or in health? I'll say this is a question, obviously, for me personally around health information, being a physician and public health leader. It's a larger question for society in other areas as well. A lot of the work around mis and disinformation actually started in the political realm, much of it overseas, outside of the United States on a global basis. I imagine you'll have future questions about what we actually did during the panel, but I'm happy to talk about that as well.
If you want to go ahead and just expand, what
Yeah.
did you do as part of the panel, and what were those criteria that consumers can use in identifying and sorting out what's credible in that?
So our goal, we had kind of 2 phases of this work. Our goal was to decide how do we provide a stamp of approval for people that we deem to be credible. We weren't looking at the content of each individual message that folks were putting out on social media, nor were we looking specifically for YouTube, but rather how could social media companies in general think about what types of people or organizations were more likely to be credible than not. In the first phase, we looked at kind of health centers and accredited health organizations. In the second phase, we expanded our work, looking at individuals, at for-profit institutions, nonprofit, and community-based institutions as well. And we laid out some criteria that won't surprise any of you in the audience, things like, in general, does this source cite peer-reviewed literature? In general, do they disclose their funding sources? In general, do they avoid the use of hate speech as some of the types of criteria? And then for those formal organizations, also looking at whether there was accreditation or not, recognizing that globally, you can't say on an individual level. Here in the US, we can say, is this physician board certified as a kind of baseline standard? But if you look globally, board certification is really different. So there was a lot of push and pull around what that could look like to improve diversity and equity. I'll say a big part of this work around identifying credible messengers was creating a bar and a check mark that people could get to then amplify this more trusted information. But what the work turned into was also a discussion about how do we get more people involved in this credible messenger space? How do we give people and organizations and some kind of more diverse voices the tools to be able to meet these standards?
So Neera, what is YouTube and Google, for that matter, doing to implement what Megan and her colleagues discussed, the guidance they formulated? What are you doing now to elevate good information?
Yeah. I mean, I think starting, a couple levels up, which is why do we care so much about information? I think everyone knows that there are known determinants of health, social determinants of health, like housing and education. But what the pandemic really highlighted is the importance of information as a determinant of health. So information is a determinant of health, and as an information technology company, Google and YouTube have a responsibility to uphold the quality of the information that users find when they're coming to our platforms with health questions. But that gets into the question of what is quality? And there are a number of different pillars that we think about in the definition of high quality health information. One of those pillars is accuracy, the validity of the content. And we know that the credibility of a source is actually a very good proxy for the validity of the content. It's not a perfect proxy, but it's very good. And that is why we approach the National Academy of Medicine with this question of, how do we define what a credible health source is? So that was kind of the lead up into this work, and why this work was so important, and why we really wanted to have an authoritative external body like the National Academy of Medicine convene a panel and bring experts in like Megan to really discuss this issue and set out the definition for what the source is, really not just for Google and YouTube, but for all tech platforms to be able to use this definition. And so to get to your question, now that we have the first paper, which was published in the summer of 2021, and then the follow-up paper, which actually was just officially came out a couple months ago, we have been able to leverage those definitions and apply them to launch health features on YouTube. And what do I mean by that? Basically what I mean is that when we think about users coming to our platforms and looking for information, we want to elevate, we want to raise the highest quality information so that that is what they find when they're asking those health questions. And we do that in two ways. One is that we elevate information from sources that are deemed credible by this definition that Megan just laid out through a feature called shelves. So bringing them kind of up to the top of that screen. So it's kind of the first thing that you see. So there's kind of a location approach to this. And then there's actually what we think of as a cue to the user that, yes, you are seeing information from a credible source. And that cue is a label beneath the video from that source that says, you are viewing information from a credible source. Maybe it's an accredited hospital, maybe it's a government organization. And if you're interested in how we're defining the credibility of the source, you can actually find out more information on our help center, which actually goes into great detail about all of the work that Megan and team did in this space. So those are the two, and we can dive into why that's important, but that's kind of the overview of how we've leveraged this definition to really launch product features on YouTube.
So some people might have been following some of what was happening over the weekend. Peter Hotez being challenged to debate whether vaccines work or not. I think part of what's complicated here, right, is that scientists are trained in the scientific method. Debate is about rhetoric and values and emotion and storytelling. But how do we, on the other hand, train scientists, doctors, other healthcare professionals to be better communicators and to leverage those tools?
So I'm going to actually take that from two sides. One is around training doctors and other health professionals. The other side is training the public, because it's a little bit of both sides, right? How many of you in the audience would identify as health professionals or scientists? So, right, and so we got trained about how to read a paper, how to assess the value of evidence, which level of evidence are we looking at, is there bias in the paper that we're reading? This is not training that the general public gets. This is also not actually tremendously useful when I'm communicating out into the larger world. If I say, well, this has a grade 1 level of evidence, or this is a meta-analysis, as you tweeted about yesterday with COVID vaccines and myocarditis, you did this great tweet about meta-analyses, and you had someone coming back to you and saying, oh, but the preponderance of studies say the opposite. And you're like, no, that's the point of a meta-analysis. It brings together all the studies and synthesizes the data. So you have to figure out ways for us as physicians or other healthcare professionals to change our language, to talk more simply, to say this is what we know right now. And one of the big things, of course, that we learned over the course of the pandemic is to also say, but it might change, right? This is the current state of the evidence. This is what we know. This is what you should do. As a physician, as someone with a master's in public health, I never learned in either medical school or in my public health training how to communicate. It was never took a course, never had a seminar, never had the chance to practice. It was all stuff that I kind of learned on my own and learned in collaboration with friends like Celine. So I think that we have an obligation to actually create those training programs for medical students, public health students, nursing students, and expand from there. Pharmacists have a huge role to play, physical therapists, social workers, and so on. I think that one of the things that we've learned over the past few years is that really needs to be a core competency for us. hopefully in communicating in the patient room, but also for those of us that do choose to communicate out onto a larger sphere, how do you summarize quickly and describe actionable steps, while also allowing for the fact that science is science, and any of us that have been in this world for more than a couple of years knows that evidence changes. The other side of it, though, is for the public. And when I look at that debate around Peter, first of all, huge kudos to Peter for being out there still. Many of us have pulled back a bit from Twitter over the last year or so because the volume of hatred and trolls has gotten so high. So I just want to start by saying the first and biggest thing is showing up. But the position that he was put in was an almost unwinnable position. Because when you are debating in the eyes of the public, if you have folks that don't understand how to think about assessing the value of evidence, like you said, he's going to be exposed to rhetoric, not to actual data. And so I think there is also a big role for us to think about in training the public in what we think about as being pre-bunking, or a term digital inoculation, which I'm moving away from because of the debates around vaccines. Right, and this is part of it. Like, how do I stay away from the hot button words that will alienate part of my audience? But this question of how do we train people to listen to these discussions and take them with a grain of salt? How to identify as just humans, if I'm hearing information about something that I'm not an expert in, when those alarm bells should go off. And generally it's when people are being hysterical, when they are saying claims that go fully against anything that you've ever heard before, when people are preying on the emotions of specific vulnerable groups. Those are often signs that something that you're hearing might be twisted or even false. And so to me, that debate with Peter really was kind of both sides of both what do we need to do as healthcare professionals to stand up, but also how do we help the public to not get taken in? And that's not after the fact. Once someone has already heard those mis or disinformation claims, it gets much harder to change people's minds.
Well, and science is about creating knowledge. Debate is about winning. So those are very different activities, enterprises. Neera, what are your thoughts on this?
Yeah, so I think, there's a lot of discussion around combating mis and disinformation, which is absolutely critical to upholding the quality of information across the internet and generally. But the way that we think about it is that is really only kind of one piece of the puzzle. It's kind of like having a garden. You can't just pull out the weeds and expect to have a flourishing garden. You also have to plant the seeds and water the seeds you want to see grow, and that is how you really cultivate a healthy, high-quality information ecosystem. When we think about planting those seeds, that's really where it comes into the work we were discussing before, which is the raising up of that high-quality information, which is both identifying what that means, and then actually applying those features to raise it up. In terms of identifying quality, we talked about accuracy as one component, but there are several other components, including accessibility. So from a health literacy perspective, is it understandable? Actionability, can the user actually make an empowered health choice based on that information? And very importantly, authenticity. Authenticity is essentially the user actually resonating with what they're seeing from that messenger, meaning that the messenger who is delivering the information is just as important as the message that they are delivering. And I think this really gets into your point about the importance of communication education. So there's a piece on kind of the raising up side, which is that we can't just raise up accurate content. We have to raise up high quality content, quality meaning that it's both accurate and that it's authentic. It's really resonating. It's hitting the end user at a place where they think, yes, this feels like something I can take, I can use, it's meaningful to me. I also think you've made a very good point about the weeds part of the garden, right? And so there's two things there. One of them is, yes, pulling out the weeds, and that's very important, but it's also helping the user identify that those are weeds. And I think that is the point that you're making, and I think their pre-bunking is an amazing tool that we have to actually help empower the user so that if they come across those weeds, they know that that's what that is, while we are also doing the part that we're responsible for, which is raising up the high quality information and removing the really egregious, very harmful misinformation.
So another way of framing that is moderating versus what some people call flooding the zone with good information. In the past, the media mediated, in a sense, between scientists, other experts, and the lay public in terms of translating that information. With the rise of big tech, social media companies, the business model of journalism has really collapsed. What would you say is the best way to counter disinformation in terms of flooding the zone with good information when you do have the weakening of media? Whether that's local newspapers, magazine business, now even linear TV, do social media companies have a responsibility, not necessarily legal, but ethical, to fill the gap here somehow?
What is the best way? As a scientist, I will say there is no single best way. There are a number of different strategies that we can take. I think it is a combination of flooding the zone, which I can talk a little bit about. Thinking about that identification of those true disinformation sources, but also thinking about the business model. So I'm going to take each of those in turn. First one, flooding the zone. It's training more physicians, health professionals, nurses, et cetera, on how to communicate. It's also creating spaces where we train community-based organizations on how to communicate. I am not the most credible messenger for many of the communities with which I work. One of the things that we did during COVID was work with community-based organizations on COVID vaccine information. This was funded by Rockefeller to help CBOs in anchor cities to develop their own messaging for their own communities around the safety and efficacy and the fact that COVID vaccines were free, and to get that out to their constituent communities. One of the things that we found as we did that work, we thought that we were going to come in and train on here are the messages and here are how you communicate them most effectively, but we found that we actually had to take a step back and train people in this is actually what the truth is about the COVID vaccines. Because just as the communities had been flooded with misinformation, so had the very leaders within the community-based organizations with which we worked. So when I think about flooding the zone, it is not just about those of us that consider ourselves to be experts. It's actually much, much more about creating spaces where those of us with expertise can translate what we know and share it effectively with the larger community and empower them to go out and take the message out in whatever way they see most appropriate. This is a core foundation of my work around firearm injury prevention, much of the COVID risk reduction. I know the last session was about reproductive rights. How do we get good information out about what is and isn't legal, what you can do depending on what state you're in, right? Each of those things, you need to think about who is the trusted messenger in that community. And our job as communicators is to create spaces, or as experts, is to create spaces where we can share that knowledge to empower more communicators. In terms of getting rid of mis and disinformation, it really is a fine line. I have very strong feelings about some of the folks that are big purveyors of disinformation, but I will say that those are the minority of folks out there. And I have some hesitations because I was just reading the Times this morning, and there was another article about kind of the origin of COVID. If I go back 2 years, we were all concerned when they started talking about the lab leak hypothesis. Is this true? Isn't it? Didn't want that to dominate the news because we really wanted to focus on how do you prevent what's in front of us, which is stop people from getting infected and dying. The origin deserves to be investigated, but that shouldn't be the primary news story. There are some folks within my community who feel unbelievably strongly that there was no way that this was a lab leak and wanted to label discussions about lab leak as mis and disinformation. That would have been wrong because we truly did not know. And so I think it gets at this point that how do you actually figure out what is mis and disinformation? Again, there's sometimes that it's super clear, like saying that COVID vaccines kill people. They don't. There are, of course, some risks, but they are very, very small compared to the benefits. But that line is often murkier than we think, which gets to the last part, which is, as you talk about how the business model of journalism has collapsed, there is a business model out there that has not collapsed and is in fact thriving, and that is the disinformation business model. So just to be very clear, there is tremendous money that goes into these huge purveyors of frank disinformation. I mean, these are like the real lies. Again, things like COVID vaccines have killed millions of people, which is absolutely not true. that is funded by big money. And they not only help create the messaging, they help disseminate it. They set up these copy and paste messages that you see propagate. Many of us sitting up here have been subjected to some of those hateful messages that, they'll look for certain keywords, and then you get this flood of trolls attacking your tweet or your post. And it's tied to a business model on the other side. It's not just dark money funding these organizations, but there's often also a sales pitch on the other side, right? COVID vaccines kill you, but you can come and buy my vitamin infusion, or my, name the thing that has zero evidence behind it. You can buy my hydroxychloroquine, and those folks then make a lot of money on the other side. And so, to me, one of the really big things that we have to think about, I don't think this is on the social media companies at all. I don't think it's on us as health professionals. I think it's on our larger kind of national and international policymakers, is to think about how do we break that connection of that dark money that is funding these really powerful disinformation webs that none of us sitting up here, and probably none of us in the audience, have the time or the finances to combat. And that, to me, is one of the big questions. There are people that will say, well, we need to fund kind of the opposite communication groups, which I think is also true. We've seen over and over during the COVID pandemic how the federal government was really caught on its back heels when things would develop. You could have predicted that there would be these rises in misinformation around kids and vaccines, for example. There was no strategy in place because there was no money to create that strategy. So I do think there's value in investing in creating good information networks, but we also have to break that financial model for disinformation.
Nira.
Yeah, so kind of just to put it all together in terms of some of the things I've already spoken about, we think about upholding the quality of information across a 4R framework. So we raise up high quality information, we remove information that's violative against our public policies, we reduce information that's borderline, so not violative, not going to be removed, but borderline content, and we reward trusted content developers. And I think that your point is very well taken, which is that if you zero in on that information that's sitting kind of in that remove area or reduce, that information often goes viral. And why is that? If you go back to the definition of quality and you think about those pillars I was talking about before, so accuracy, accessibility, actionability, authenticity, the problem with dis and misinformation is that it often has 3 of those pillars, but it just doesn't have the accuracy piece. So those 3 pillars together are what makes information often go viral. And so I think that when we come to the business model here, there is definitely a piece around what is our overarching strategy, the predicting when these issues are going to come up, which I think we can do a much better job of. And then the second piece is really back to Megan's comment about communication education, because if we are increasing the high quality information that we have, that is not going to be effective unless we're hitting those 3 pillars that drive virality. And then I think the third piece around, which is, I don't think really the responsibility of social media companies, but I do agree with, which is pulling the funding, breaking that funding mechanism that's funding those disinformation campaigns is also very critical. I think that sits more in the public sector, but yeah.
So I want to come back to the education component in a moment. We just talked through the business model of disinformation. We are a capitalistic society. So what is the business model of good information? Is there one?
It's a great question. What do you think?
I'm here asking questions.
So I think that there is a business model, and to me, that's around kind of some of the health companies, either pharmaceutical, health systems, seeing that there is value to their constituencies having good information, right? You are going to have, if you're an insurance company, there is a great business argument to be made behind the people that you insure having access to good information so that they have healthier choices. They don't end up sick and hospitalized in my ED or ICU, so that they don't, right, there's kind of that whole spectrum behind insurance. I think there's arguments for companies that sell healthcare products wanting people to have access to good health information because you want folks to buy your pharmaceutical that actually works and not to buy something that's out there that's pure quackery. Ultimately, I think that there is, though, there is an element of, and again, it's a very sticky ground, but there's an element of social good behind this, which is not a business model at all, and which gets into these, here we are at Aspen, which is all about creating a just society, and it gets into these very sticky value discussions that many of us have sitting around seminar tables on this campus. And I think it's a big thing that we need to grapple with, and we're going to need to grapple with even more with the rise of AI. This amount and speed of misinformation getting out there is only going to rise. So there's some business model, but it's more around investing in it as a social good.
Nira.
So I think that we're already investing in the business model of high quality information, and we're doing that by very actively taking a stance and launching product features that raise the discoverability of high quality information and rewarding those trusted content developers. Essentially what we're saying is bring high quality content to our platform and you will be rewarded for that. Your content will be more highly discoverable by users. You will be better able to get your message out. You can be rewarded monetarily for that through a variety of different mechanisms. And I think that that is really important to really, for platforms to take a stance that says, we are not, again, back to the garden, we're not just going to be worrying about combating the mis and disinformation, but we really are going to reward the organizations and individuals, and there are many individuals who are doing excellent work in this space, to bring that information to platforms, not just at Google.
So shifting to the education side of this, what responsibility do academic institutions, and you sort of represent that, Megan, what responsibility do they have for developing and promoting and rewarding communications and engagement skills? As we both know, this is not how you get promoted in academic institutions traditionally. And should grant-making institutions like the NIH be funding communications and public engagement?
Yes and yes. That's the easy answer. I will say one of my pillars as the incoming dean of the Yale School of Public Health is around communication, making sure that we have courses in this for all of our students, making sure that we serve as trusted sources of information in partnership with community organizations. I think this is a key function of academia in this moment. If you think back to where academia came from in the Middle Ages, right? We were, along with at that point religious institutions, the holders of knowledge. We maintain knowledge in a point in which knowledge was greatly debated and not available to many, and that then grew into the Renaissance. I think that we have an obligation in this moment of tremendous societal turmoil to continue to create space for debate for the creation of science, but also to create space where best practices in communication are taught and elevated. In terms of grant funding agencies, 1,000%. I am, one of the things that I actually think is really interesting, when I get foundation money, there's often funding in it for a communication and dissemination plan. The Centers for Disease Control and Prevention increasingly require a dissemination plan in my grants, NIH less so. They care much more about peer-reviewed publications. So I would love to see grant agencies not only make that part of the grant application, but also for us to be able to allocate funding to doing that work. The last part you asked about incentives. This is something that I will be taking on as dean, but I think that we need to take on in general in thinking about how do we incentivize communication, but also how do we teach people how to communicate well. The reality is that I am still a professional, I am still an expert, and certainly as I come in this academic leadership role, although I may say that my words don't represent my institution, to a certain extent, if I go off and kind of say certain things, it's my institution that's going to get all the phone calls. And I have a dear friend who says to me that she knows when something that she's done has gone viral because her friends at the hospital switchboard will say, "Did you just write a piece?" Because they start getting phone calls. And so I think that is part of the communication element, is kind of helping folks to recognize the impact of their words. Again, creating space for free expression, incentivizing that external communication, helping people to do it in a way that creates positive change rather than division.
Well, and everything has a business model, including academic medical centers, right? So if there's no money in it, they're not going to want to support and reward that kind of activity. Social media platforms have a unique position in that they really do see what goes viral, right? What kind of communication. Is there a role for social media platforms to be helping train communicators, leveraging that knowledge?
Absolutely. I think that where we've started is that definition of quality, and the next phase is really helping organizations and individuals. And we've done this in some capacity so far, but we're expanding this work, which is how do you put that quality into action? How do you actually make that happen? Because I think it's important to take a step back and remember that kind of who is at the center of this. And the center of this, you can think of it as an individual. It could be a patient. And that patient actually has very limited time one-on-one with their clinician at the bedside or in the clinic. Most of their health decision-making and most of their health education is actually happening outside the clinic door. It's happening around the dinner table. It's happening at their work. It's happening with friends. And I think it's very important that as we think about clinicians and the next generation of clinicians being able to educate both at bedside in the clinic, but also outside those doors, and how do we think about proliferating those high quality messages, I do think that social media has a very important role to play in that, because we have the data of what's working. And we can translate that data into training programs in partnership. And I think that that will go a long way to helping cultivate that high quality health information ecosystem.
So I'm going to ask one more question, and then we'll start taking questions from the audience. So start thinking. Efforts are mounting in Congress and the courts against social media platforms, universities, think tanks, et cetera, that study disinformation. America First Legal has filed a class action lawsuit targeting some of these people who are doing this research, even students. And individuals and organizations who are working on disinformation are facing now mounting legal costs, not to mention some of the harassment and trolling we alluded to earlier. These folks are doing what they can, right? It's not to make money or to gain power or fame. They're doing it because it's the right thing to do. But who's going to protect them against these costs, whether those are financial or reputational or personal?
So for folks that are part of a university, in general, the university's legal team will help. This is where, of course, making sure that as you communicate, your local media relations folks are aware that you're out there, because that helps with the likelihood of protection. I'm going to take a step back with just to say how unconscionable I think it is that folks are being subpoenaed and having their records pulled when they are pursuing science. To me, that's actually the bigger question, is why we're tolerating this as a society. And I think it's a tremendously dangerous and slippery slope to go down. I would love also to see some public kind of philanthropic legal funds, because again, the resources of those that are trying to attack science, they have great resources, and it is deeply dedicated to this issue, and university legal teams are often not experts in fighting this type of thing. So I think that just as, you know, if we talk about kind of reproductive rights, if we talk about other issues, having those publicly accessible legal funds for those who are particular targets would be a tremendously helpful thing as well.
Yeah. Nira.
Yes, I mean, I couldn't agree more, and I think that there are the individuals who are part of larger organizations who are doing this work, and then there are individuals who are doing work, whether it's direct research or even putting out more kind of communication style around dis and misinformation. And those informations are critical to this ecosystem. And if we can't support them through public funds, if they are being attacked in this way, we're going to lose that part of the ecosystem, which is so, so critical in this mission to create a high quality health information ecosystem. I don't think that, I agree with Megan. I think that unless we figure out a way to make funds accessible to those individuals, I think that we're going to lose the battle.
I also just have to say that to comment on that chilling effect, what that does even more than the legal fees is it tells the next generation of students and researchers to not take on this issue.
Yeah.
Again, I do, a majority of my work is actually around firearm injury. For those who don't know, in 1996, there was this thing called the Dickey Amendment passed that basically removed all the money from the federal government that they had been spending on firearm injury prevention research. As a result of that, I was told very directly in my early days as an academic researcher and as a physician to not talk about firearm injury as a health problem because it would kill my career. For about 24 years, we had no funding. There were somewhere between 7 and 15 people across the country who were doing work on firearm injury as a health problem. So that chilling effect is unbelievably real. And that is my bigger, just to put a finer point on it, that's my bigger worry about the subpoenas. It's not just the legal costs. It is that impact on the ecosystem of folks that care about this issue and that are trying to make the world a better place.
And a lot of these individuals, I mean, especially creators are, you know, I think about YouTube, creators are at the heart of YouTube. These are very talented individuals who are out there communicating complex issues, sometimes controversial, in very engaging and compelling ways. And if that chilling effect takes hold, it is going to completely kill that life of the ecosystem, which is what's driving the quality of it right now.
Any questions here?
He's good, quick with a hand.
Quick on the draw.
Yes, good morning, Francis Najafi from Arizona. I am a bit confused. I know that this topic was well covered, but I'm still unclear. Ultimately, the question of how either a search engine or social media, digital platforms, algorithm works that really is based on essentially the profile of the individual versus the 4 category that Mira, you identified. I don't really understand still how you reconcile those conflicts. One is business model driven based on a particular individual. The other is you say no, the algorithm and search is also try to balance the 4 categories. I'm not really convinced of that. Maybe you could elaborate on that. Thank you.
Sure. So I think that one distinction that's important to make up front is that, and Megan alluded to this earlier, there's a difference between the source of the information and the information itself. And what the work that we talked about at the beginning of this talk was around the source and how do you identify a high quality source. And using some of the principles that Megan laid out, we're able to essentially identify, and we have an open application process for some of these organizations to apply and say, do you qualify as a high quality source, as a credible source? And if you do, then you're eligible for treatment with these specific product features that, again, algorithmically raise content from that source in search and discoverability, meaning that it is more likely to be discovered should someone be searching for information that source provides. So that's kind of the way that we're connecting the definition of the source credibility to the algorithmic features that raise it in discoverability. Not sure if that answers the question.
And it's worth actually maybe you showing him after when we take a break.
Yeah.
Because I had to have somebody show me what the search looks like if you plug in diabetes, for example.
Yeah.
Now I get it, but
yes,
it's a visual
actually,
thing.
we often have slides when we talk
They're
about
really
this,
nice slides.
Which makes it, they are really nice slides, but we don't have them today. So.
Next question, please. Over here on the aisle.
Hi there, my name is Rohan. My name is Rohan. I'm a neurosurgeon at Weill Cornell Medicine and co-founder of this app called Rune. And one of the things that we're trying to do is create an ecosystem for science-based communication. But we're competing with apps like TikTok that reward people who want to dance and do that kind of thing, whereas most doctors, most other healthcare providers that are experts don't want to do that, right?
Got to learn to dance.
Part of virality is also entertainment.
Yes.
Right? Also tugging on conflict, fear-based thinking. So how can doctors, providers create compelling content that still competes with that kind of thing, short of you guys specifically, disempowering all the disinformation, specialists out there?
It's a really excellent question, and it comes back to that pillar around authenticity. And what does authenticity mean? How does that drive engagement? What does it mean to have engaging content? And I think there's a number of different ways you can think about it. One of them is there's actually quite a bit of content that comes from creators who are just authentically themselves. And they're just speaking at the camera, but because they are authentic to a certain type of user, that message resonates. So I think there's that piece of it, which is that it doesn't have to be kind of, dancing and bells and whistles and stuff to actually resonate and really reach that target audience. There's another option that we really did leverage quite a bit during COVID, which worked really well, which was what we call collaborations. So collaborations between expert voices and, to Megan's point earlier, those trusted messengers that are reaching specific communities, and pairing those together, and maybe even running that content on both channels so that you're really reaching a much broader audience is another way to think about it. But I would just kind of re-emphasize how successful we see sometimes very just genuinely what people would think of as low production quality content, but that really gets a lot of viewership because how that person is delivering the message is resonating.
And to give you an example of this, actually, from one of the places where I work, CBS News, when we put something that was filmed on stage versus one of the anchors just filming something on their phone, the phone video is what does better.
And I, just to really kind of emphasize that point around collaboration, I think many of us as healthcare professionals want to communicate, we should, but we should not expect ourselves to be as effective and engaging as Mr. Beast. Mr. Beast spends lots of time studying how to make his videos go viral and be unbelievably attractive to people like my 12-year-old son, right? His favorite channel. I could never be Mr. Beast, but you could imagine when Mr. Beast does a collaboration with a healthcare professional, that then gets the information out. And so I think that's much more of the trick here than trying to make ourselves necessarily go viral, because that's also inauthentic for who we are.
One last question. This woman here, yeah, you, sorry.
Hi, I'm Alex Castillo-Smith, and I'm the Secretary for the New Mexico Human Services Department. So Medicaid, SNAP, we serve more than half of New Mexicans with our programs. And as you were talking about, how do we flood the good information with our health professionals and other trusted messengers? I thought an idea for a business model that I'm going to take back. And I've been thinking about Medicaid and the Centers for Medicare and Medicaid Services. And so the problem is, a lot of times, as I'm sure you probably know, Megan, providers can't take the time off of providing clinical services to get trained because they're losing revenue. But we just got an approval from CMS to reimburse providers for training with certain kinds of evidence-based behavioral health practices. And so I'm thinking about, I don't know if anyone from CMS is here, but I'd love to think about it, but how do we get CMS to pay for health communications trainings for professionals? I think, I think that's a great idea.
And Alex, can I just add in also to pay public health agencies to do health communications? Because there's very limited funding for our departments of health to get trained in or to provide much of this critical information as well.
Yeah, because then I'm thinking about, how could we require in our Medicaid contracts and MCOs, how can we put contractual language for these health communications trainings for our providers, for our patients, for New Mexicans? But then I think, I'm just trying to think about what can I take back to Santa Fe? And then I know the question CMS would ask would be, well, what's an evidence-based health communications curriculum? But I would be interested in seeing one from a decolonized perspective, because in New Mexico, as you may know, we are a majority minority state. And so being able to have a different set of curricula to respond to different groups of professionals and people. And so that's what I'll take back, how we talk to CMS, and maybe, because it is a determinant of health information.
Absolutely.
And we need to pay providers to train it, and CMS might have the flexibility under this administration to do that.
It's an interesting point that you're making, because I think this is one area we've seen a lot of creativity during the pandemic with what are called 1115 Medicaid waivers, trying to use that funding to supplement various public health activities, and you could consider this to be a public health activity. So thank you for that, and I do hope that this conversation will generate more out-of-the-box thinking and creativity about how to combat disinformation. So thank you, everybody,
Thank
for
you
being
all.
here.
Nice job.